Have you ever wondered why understanding a medication's profile is so important? It's like reading the blueprint of a house. It tells you the structure, the use, and even the potential pitfalls. Medication profiles are essential. They provide crucial information about a drug, its indications, dosage guidelines, how it works, and possible side effects. This knowledge can significantly impact a patient's health and treatment outcomes. So, let's embark on a journey of understanding. In this video, we will delve into the medication profile of one such drug, Olmesartan. So, what exactly is Olmesartan, you might ask? Well, it's a medication that falls under a category of drugs known as angiotensin II receptor blockers, often referred to by the acronym ARBs. This might sound like a mouthful, but it simply describes the way that Olmesartan works within the body. Angiotensin II is a compound in our body that can cause blood vessels to narrow or constrict. Olmesartan, as an ARB, blocks the action of angiotensin II, helping to widen or dilate these blood vessels. This in turn aids in reducing high blood pressure, which is the primary use of Olmesartan. But it's not just about lowering blood pressure. By doing so, Olmesartan also helps reduce the risk of serious health complications, such as strokes and heart attacks. It's a small pill with a big job, protecting our hearts and overall health. Now that we know what Olmesartan is, let's move on to its indications. Olmesartan is often prescribed for a specific set of conditions. At the core of its many uses, Olmesartan is primarily employed to treat hypertension, also known as high blood pressure. This condition can cause various health complications if left unchecked, and that's where Olmesartan steps in. By relaxing the blood vessels, Olmesartan helps to reduce blood pressure. It's like clearing up a traffic jam on a busy highway. Everything flows much smoother when there's less congestion. And with this smoother flow, the heart doesn't have to work as hard. But the benefits of Olmesartan don't stop there. By managing hypertension, it also indirectly helps in lowering the risk of more serious health conditions such as heart attacks and strokes. These are some of the major health threats that people with high blood pressure face, and Olmesartan acts as a shield against them. While Olmesartan is incredibly beneficial for these conditions, it's crucial to understand the correct dosage guidelines. Knowing the correct dosage of any medication is a crucial part of effective treatment. And this stands true for Olmesartan as well. Generally, the starting dose for Olmesartan is 20 milligrams once daily. However, if blood pressure is not controlled, the dose can be increased to 40 milligrams daily. For some patients, a dose of as high as 80 milligrams may be prescribed. But remember, these are just guidelines. The exact dosage can vary widely based on the patient's condition, age, and overall health. It's also important to note that Olmesartan can be taken with or without food, but it should be taken at the same time each day to maintain a steady level of the medicine in your body. And while Olmesartan is usually well tolerated, it's not without its side effects. These can range from minor issues like dizziness or lightheadedness to more serious problems such as kidney issues or low blood pressure. Always consult your doctor if you experience any side effects. While Olmesartan can be incredibly beneficial, like any other medication, it's not without its side effects. Every medication has potential side effects, and Olmesartan is no exception. As we delve into the realm of Olmesartan's side effects, it's important to remember that everyone's body responds differently to medication. The side effects we discuss here may not occur for everyone, and if they do, they might not be as severe. However, being aware of them can help you be better prepared. Olmesartan, like any other medication, can cause a variety of side effects. Some of these are quite common and relatively mild. You might experience dizziness, especially when standing up from a sitting or lying down position. This is usually temporary and should subside as your body adjusts to the medication. Another frequently reported side effect is nausea. If this becomes severe or persistent, it's essential to contact your healthcare provider. They may suggest ways to reduce the nausea or may consider adjusting your dosage or medication. Now, Not all side effects are this common or mild. Rarely, Olmesartan can cause more serious complications. These include kidney problems, which may manifest as changes in the amount of urine or swelling in your ankles, feet, or hands. If you notice these or any other unusual symptoms, it's crucial to seek medical attention immediately. We also need to touch on the potential for an allergic reaction. While this is rare, it's important to be aware of symptoms such as rash, itching or swelling, severe dizziness, or trouble breathing. If you experience any signs of an allergic reaction, immediate medical attention is necessary. But before you start worrying, remember that your healthcare provider has prescribed this medication because they believe the benefits outweigh the risks. It's a calculated decision aimed at improving your health. However, if you experience any side effects, don't hesitate to report them to your healthcare provider. They are there to help you navigate this journey and make the necessary adjustments to ensure your well-being. Remember, the goal of any medication is to improve your health, not harm it. So stay informed, stay alert, and most importantly, stay healthy. We've covered quite a bit about Olmesartan today. In our journey through this medication profile, we've gotten to know Olmesartan in a comprehensive manner. We started off by understanding what Olmesartan is, a potent oral medication that's part of the angiotensin receptor blocker family of drugs, primarily used to treat high blood pressure. We then dived into the indications of Olmesartan, how it's typically prescribed for hypertension and can also be used to reduce the risk of heart attacks or strokes in patients with cardiovascular disease. It's a versatile medication that has proven its effectiveness in several clinical trials. From there, we moved on to the dosage guidelines. We learned that Olmesartan is usually taken once daily, with or without food. The initial dose can be adjusted based on the patient's response, but it's crucial to remember that it should always be taken under the supervision of a healthcare professional. Lastly, we explored the potential side effects of Olmesartan. While it's generally well tolerated, some people may experience dizziness, lightheadedness, or kidney problems. It's important to monitor these symptoms and consult with a doctor if they persist or worsen. By understanding a medication's profile, you can make informed decisions about your health. Remember, your health is in your hands.